We are talking the holistic side of your mouth today. My guest is Dr. Toni Engram. She's a biological dentist, integrative health coach, and owner of Flourish Dental Boutique in Richardson, Texas, which I found out is right outside of Dallas. After her own personal health struggles with an autoimmune disease, Dr. Engram shifted her practice philosophy to focus on whole body health. She has degrees from Texas Christian University and Baylor College of Dentistry. She's a member of, she talks about this a lot, the International Academy of Oral Medicine and Toxicology. That's a great resource for finding these types of dentists. And yeah, she has a bunch of different accolades, and we'll go ahead and get into the juice here today. Like, she's sharing, I'm into biological dentistry. We've had other biological dentists on the show, but I just really love how she gave like the straight rundown of like, here's what you need to know. Here's what's not good. Here's, where I stand with things. She has a really fair take on things too. Like, there's no like agenda here. She's just sharing great information. So yeah, you're going to learn a lot. If you'd like to visit her website, it's flourish.dental, like flourish, like thrive, flourish.dental. And you can find her on Instagram as at Dr. Toni Engram, and obviously Toni with an I, Engram. So let's get all into it and let's find out like the whole holistic side to your oral health. This episode is brought to you by Peluva. So Peluva, P-E-L-U-V-A, those are Mark Sisson's new zero drop minimalist shoe with that distinctive 5-toe design. I have been loving them. I've been a long time fan of barefoot shoes, and I was very resistant to the little 5-toe articulation personally at first, because just being real, I thought they looked really nerdy, and I was like, oh man, yeah, I love Mark so much and I get what he's doing, but I'm not wearing those nerdy shoes. And then Brad Kearns, who's also involved with that project, was like, no, Tara, you got to try them. Tara, you got to try them. Tara, just come on, try them. And I tried them, and I kid you not, I enjoy them so much that I actually like how they look now. Weirdly, I can tell. So like the purpose of that 5-toe articulation is so that your toes can move more dynamically. So with other barefoot shoes, like I've been a long time fan of Vivos, and I'm still a big fan of Vivos, but they have just that big toe box, right? Which is awesome. So I didn't really feel like the 5-toe articulation was necessary, to be honest. But as I've worn them, I have experienced how awesome that is. It was actually been quite surprising for me. And I wore them this morning. I wear them all the time, and I'm really, really enjoying that freedom of movement on my toes. So yeah, Brad and I have been going back and forth. I'm like, dude, I actually love them. And he offered to sponsor the podcast with Peluva and also offer you guys a 15% off code, which I was like, okay, cool. Yeah, I will gladly introduce my people to Peluva shoes. So you can use code Coach Tara at peluva.com, or you can just go to peluva, peluva.com/Coach Tara, and you can get that 15% off discount. Make sure you snag some of the socks while you're there, because you're going to need the toe socks. Okay. All right, let's get into the episode. All right. So, Dr. Toni, could we start out by just helping people understand the difference between typical, what would you call it, traditional dentistry and biological, is that how you say it? Biological dentistry?
Yeah, and it's so confusing in the marketplace too, because there are, like, some people will say holistic dentistry, biological dentistry, and there's functional dentistry, biomimetic, like there's all so yes, you're
Okay.
fine. I'll answer to whatever. And it's so to explain it, I'll start kind of high level, and then I'll get down into like what that actually means. So just high level, your typical like Western medicine, allopathic care, normal, quote unquote, normal dentistry is all based on the germ theory of disease. So one germ causes one illness, and therefore one treatment or one medication could then help that one illness. Where biological medicine and biological dentistry goes beyond just the germ theory to really focusing on the terrain theory of disease, which says we want to support the entire biological terrain, meaning the entire human body. So when we're practicing medicine or practicing dentistry, we want to look at what are we doing to support the entire body? Like, what are we doing to support health Or are we adding to a toxic burden? Are we adding to that person's toxic bucket, and making them more prone to have illness? So that's kind of the underlying principle behind it. But what that means in practice is that we're trying to minimize toxins where we can. So things that are known to be toxins, like fluoride at certain doses, I avoid that in my practice completely. Those old silver fillings that are half mercury, we have really, really specific protocols on how to remove those. We don't place them anymore. But even removing them, we have to be really careful. And we're looking for sources of hidden infections, like root canals, that could have hiding infection where old extractions were done, looking to make sure there's no infection hiding in there. And then, really, a lot of times, the best dentistry is the least dentistry. So, we're very, very intentional with prevention, with nutrition, and making sure, again, that we're helping the entire system and not just focusing on the restorative aspect of what I call like drill, fill, and bill dentistry.
Mm. Okay, you hit on a lot of gems there, so let's freaking go.
Yeah.
Why don't you use fluoride in your practice?
I don't use fluoride because, well, I will say I don't think that it is always evil. However, I think that we have been oversold on the benefits of fluoride for a long time. When you look at the rate of tooth decay in countries before water fluoridation versus after water fluoridation, yes, it went down,
Mhm.
but it also went down in the countries that chose not to add fluoride to their water.
Mm.
So it really can't be 100% attributed to fluoride. Um, and then really, especially lately, so we've known for a while that fluoride competes with iodine in the thyroid. Um, it can have a calcifying effect on the pineal gland. So yes, there are risks involved, but man, I think those risks were really underappreciated, and some of the more recent research is really concerning, in fact, alarming, around rates of fluoride and the IQ of our children. And it's, man, when it's in the water, you just can't control the dose. You can't control who's exposed to it. We don't really know which kids are more susceptible than others. So because we've been oversold on the benefits, we've, I think, underestimated the risk involved. And thankfully, I've got other tools in my tool belt now that I can use against tooth decay where I don't feel like I need it. So I just made the decision that in our practice, it's nowhere to be found. We filter it out of the water. We make sure that we source our materials so that all of our restorative dental materials don't have fluoride in them.
Mhm. Okay, so for people at home, the everyday use stuff, what would you recommend that they look for to have in their toothpaste if they're going fluoride free? What are your favorites in toothpaste in terms of ingredients to have in there?
My favorite ingredients that really have a great effectiveness and an excellent safety profile are xylitol and hydroxyapatite. So xylitol, it's the plant-based sweetener that starts with an X. Um, Great for the oral microbiome. It shifts the pH of the saliva really quickly. Does a great, great job. There was a study back maybe 20 years ago or so that found that moms who chewed xylitol gum while they were pregnant, their children at 5 years old had half the decay of of the moms who didn't chew the xylitol gum.
Wow.
Crazy, crazy stuff. Um, so I that's it's a huge tool that I like to use. And then
Mhm.
hydroxyapatite is has a little bit of controversy I've found around it,
Mhm.
which is kind of fun. Like I don't know how controversial we want to get, but in the crunchy space,
I'm up for anything.
I
Well, what you
have
got?
I still love the safety profile, and I love all the data that I've seen around the safety of hydroxyapatite, even in its nano form, because the nanoparticle hydroxyapatite is super, super teeny tiny. And in my world, my audience, a lot of crunchy moms and people who are really holistically minded don't want any kind of nanoparticles at all, which I totally get. There are concerns that it crosses the blood-brain barrier, but because they have been concerned about it, I've done as much digging as I can, and man, even with new concerns, the safety data is still really good and still way, way better than fluoride.
Okay, nice. I mean, I'm not trying to have you like promote any specific brands, but I'm curious, are there specific brands of toothpaste that have both of those that you found that you like?
Yeah, yeah. So I really like both Risewell, and my patients really like Boca, so I carry those two in the practice. Fig is another good one that does a great job. And there are more, I feel like every year there's another one or two that come out
Yeah.
on the market. Not all of them have the nanoparticle. Some of them have the slightly larger microparticle, but those are still effective in terms of ingredients.
Okay, thanks.
Yeah.
Okay, question on the amalgam fillings. Okay. I have so many questions here, but I guess my first one is like, because you're doing integrative health altogether, like if somebody comes in and they have amalgam fillings, like, do you run heavy metal testing on them, or are you just like, we know enough about these, let's go ahead and get them out? I'm just curious, like, if you've seen that actually impacting people systemically in your practice.
So I have to be, as a dentist, I have to be really careful not to practice medicine. And so I am careful to stay in my lane
Okay.
in regards to that. So I'm not having patients run heavy metal tests,
Okay.
but a lot of times they come to me
Okay.
because they've seen these tests from
Okay.
their naturopath or their functional medicine
Mhm.
doc or whomever. And so again, we know that it's a concern and that mercury is a really potent neurotoxin, but it still has to be my patient's decision if they want to proactively remove the amalgam fillings. I can only tell them if I see a dental reason to remove them, uh, because
Okay.
it
Right.
because the governing bodies in
Mhm.
dentistry don't feel that there is a health reason to remove them
Got it.
preventively. Um, but that being said, like I see really interesting coincidences with these very potent neurotoxins. Like I see people who have neurological issues who get their amalgam fillings safely removed as a part of a protocol with a functional medicine doctor. And a, a lot of times they do have amazing resolution of symptoms afterwards, which is really cool.
All right, thanks. And then yeah, like I mean, without breaking down the entire, process, like could you just share, why somebody might want to make sure they don't just like go to their regular dentist and ask them to just take them out and replace them? Like what kind of concerns are there?
Because my colleagues don't always appreciate the dangers of mercury vapor, it you will have a really large exposure to mercury vapor when you have those fillings removed. If they need to be replaced for whatever the reason is, because we know that tiny little bits of mercury vapor are released from those fillings with heat and friction. So anytime you chew, anytime you grind your teeth, if you drink hot coffee, you're going to have a tiny little bit of exposure to mercury. Well, if your dentist is taking a high speed dental drill at 800,000 RPMs, you're going to have massive amounts of heat and friction. And so you're going to have a really large exposure. There's going to be a ton of mercury vapor in the room. And a group that I'm a part of, that's the IAOMT, it's a large biological dentistry group. They developed these protocols to really help with mercury hygiene in the dental office. And it's for patients to make sure that we minimize your exposure in the dental chair, but it's also for the dental team
Mhm.
because the dentist, who's typically more prone to neurological issues than the general public because of our
Mm.
exposure over time, and our dental assistants who are typically women of childbearing age who have no business having extra mercury exposure in the workplace are often the ones who are right there helping, full face with the mercury vapor going everywhere. So it's really important. I think if you do nothing else with a biological dentist, I think if you're having an old silver filling replaced, I think that's one thing where I highly recommend traveling to go see one.
Nice. Thank you. Okay, this is a very subjective question, and I'm not sure if it's one you're comfortable answering, but just let me know.
Do it.
I'm just curious from your viewpoint, from your experience, what is the general attitude of most, traditional dentists towards biological dentists?
Oh, I'm comfortable answering that. That's totally fine. It's not as bad as it once was, and it's not as bad as I used to think it was.
Okay,
You know, I'm a
curious.
I'm a short little girl with a bit of a chip on her shoulder, and so when I first really felt convicted that I had to change the way that I practice, I really felt like all of my other colleagues were going to do nothing but talk bad about me and not respect me anymore. 'Cause it was definitely spoken against when I was
Mm,
in school.
mm.
It was seen as an unethical practice
Oh, wow.
to preventively, quote unquote, "preventively" remove amalgam fillings
Oh,
without a
wow.
dental reason to do so.
Wow.
So, it was absolutely not respected. But I am so encouraged because it's the generation after me, I'm at the trail end of the Gen Xers, the
Mhm,
millennials coming into dentistry, I think really have a much more holistic mindset. I think that they appreciate that what we do for a living can potentially cause harm in ways that we didn't know before.
mhm.
And so I really think the tide is turning
Okay.
with that. So
Yeah.
yes, I still get hate. Yes, I get trolled online, and that's okay. But as long as we keep things, you know, I stay in my lane.
Mhm,
I'm careful not to practice medicine. I'm
mhm,
careful to provide evidence
mhm,
of things that I'm saying, and so it's all good.
mm. Yeah, thanks for sharing that.
Yeah.
Okay, so I'm curious about your journey, if you don't mind sharing, so you're trained as a traditional dentist. How long were you practicing as a traditional dentist?
Um, Gosh, I don't even know because I made the transition kind of slowly over several years.
Okay.
But I
Several
did.
years.
Yeah, yeah, girl, I just wanted to be normal. I just wanted to be a normal dentist, have a normal job with a normal office in a normal little town. Um, but God had other plans, and I'm really glad that He did. Because dentistry, the way I was doing it, was leaving me just really, really burnt out. So I would not
Mm,
still be a dentist, I don't think,
mm,
if I was still doing it the old way. But
mm,
it was 2011, and I was working as an associate dentist, was working full time. I had a toddler at home. I was opening my first practice from scratch by
mm,
myself while I was working for somebody else full time.
mm.
Yeah, I know you entrepreneurs are know what
Mhm,
I'm talking about.
mhm.
I wasn't eating great. I wasn't sleeping great. I was doing all the things. I was crushing it or trying to, and I just got really, really sick and
Mm,
started having a ton of GI issues that doctors just kind of blew off and told me to drink peppermint tea, told me I had IBS. So finally, once I started losing weight and having literally blood in my stool, they finally agreed to do a colonoscopy and found that I had, moderate Crohn's colitis. So I
mm,
had this autoimmune condition and was given a very Western medicine solution, was here are your medications.
Mm,
And oh, by the way, at some point you might need surgery to remove part of your colon. And this is just the way that it is.
mm,
So I did not accept that answer. It did not sit right with me. So as I went down all the rabbit holes online, because I didn't know what a functional medicine doctor was back then. I didn't know that there were integrative physicians. I just didn't know.
mhm,
So I had to do all the research myself and try to become my own doctor around
mhm.
this. And as I started feeling better, I realized that Crohn's disease, which is it's an inflammatory condition caused by a dysbiosis in your microbiome. It's so similar to what I treat every day in my
Right.
patients. You have tooth decay and gum disease. It's all about inflammation and a dysbiosis in the microbiome in your mouth, which is
Mhm,
the very first part of your gut. So I knew that if I could figure out how to heal myself, and I did, that I had the responsibility to figure out how to do the same thing for my patients.
mm.
And so that's really what just led me to study more about the links between oral health and our overall health and learn all about biological dentistry. My patients kind of nudged me along the way too, and that's really how it happened.
Very cool. Okay, so I'm curious, like, I can see what you meant by as like a gradual process, right? Because you probably, as you're going on that journey, you're probably like, oh man, like, okay, they're probably eating like all this stuff. They've got like all this gut dysbiosis on, we're seeing it here in the mouth. There's like systemic stuff going on. I'm curious, like, how did you start that process? What were the first things that really like stood out to you that kind of pushed you into the biological dentistry route where you were like, okay, this is a problem and people don't even seem to understand that there's even a connection here.
Um, well, it started with oral systemic health and learning that there is actually data, like actual research linking oral health issues with heart attacks and strokes.
Yeah, that's like the one thing I feel like is like mainstream, right?
Yes, yes. That's how it started. But then once I was in that world and talking about nutrition, my patients would ask me, that's great that you're talking about all this nutrition stuff, but why are you still using fluoride? And so the more they would ask me about it, the more I'd have to really research it. And the more I researched it, the more I was like,
Wow.
and then once I then it was, I couldn't unsee what
Mhm.
I had seen, and then it was not just, "Crap, how do I do this?" but, "Crap, how do I do this in a normal office where I'm still in network with PPOs doing, the grind of PPO dentistry?" Um, and how do I do it and explain it to my patients who
Right.
are, just working class people who just want their free cleaning and fluoride treatment. So it took many years for me to get over myself enough to
Mm.
really go all in on the
Mm.
biological side of dentistry.
Wow. Props. Props. Okay, question. Like let's highlight this one a little bit, even though we said that that's mainstream information, but maybe some people don't know. Let's start with that. Like what is the link between what do you call it? Periodontal oral disease, periodontal disease
Yeah.
and heart disease.
It's a really strong link because if you think about it, you've got a very absorbent tissue inside your mouth. If you want to take medication or a supplement and you want it to get into your bloodstream really quickly, you put it under your tongue, right? Because
Mhm.
that tissue is so incredibly absorbent. So the same is true for all of the bacteria that's in your mouth. It's if you've got inflammation and you've got some of these pathogenic bacteria that cause gum disease, some of them are really sneaky bugs. And if you've got some gum disease going on, or if you've got even just gingivitis and a little bit of bleeding here and there, then those bacteria then enter the bloodstream and cause an inflammatory reaction in the bloodstream as well. And so it can just lead to this inflammatory cascade that contributes ultimately to heart attack and stroke.
What are those typically, those pathogens? You know, like which type of bacteria those typically are?
There's several different ones. Some of them, the ones that are most studied are, sometimes I only remember their abbreviations. AA is the big one, actinomyces,
Yeah,
actin
I know they're
something or
crazy
other.
names. Okay, AA.
Um, PG, so Porphyromonas gingivalis is another big one. There's a treponema that's a really big one that's very well studied. And we test for these in the practice all the time.
Okay.
So there are saliva tests that will test for these specific pathogenic strains of bacteria. And then the one I use is it tests for 700 different species of
Mm.
bacteria and fungus. So we can see, are the bad guys there, but how many of the good guys are there to balance
Mhm.
them out? Or is there a candida overgrowth somewhere that we need to be aware of too? So I
Mm.
like to look at the whole picture when it comes to salivary testing, so we know
Mm.
where we need to pull the levers and tweak things a little bit to get people back into balance.
Yeah, the terrain model.
Yeah, yeah.
Yeah. Cool. Okay, thanks for sharing that. What other types of, should I say disease for lack of a better word, or health conditions are commonly correlated to dysbiosis in the oral microbiome or infections and things like that?
But gut issues, believe it or
Mhm.
not. So I can, if there is a, because it's happened before, before a like a little mini flare up that I had of the just some gut issues. I don't even call it Crohn's anymore, but I
Nice.
had some little gut issues, and I had taken a saliva test a few weeks previously, and in the saliva test, it said I had one bacterial strain that was associated with GI issues. I was like, oh, that's kind of weird. And then sure enough, a few weeks later, I had that little flare up.
Wow.
So GI issues is definitely one. Um, man, anything that's inflammatory. So diabetes, any autoimmune condition, rheumatoid arthritis especially is a big one.
Mm.
Um, heart attack and stroke, fertility issues, pregnancy complications, all of those things can be related to and connected to oral health issues.
Wow. Thank you. And I heard you say on another podcast, you were talking about if you catch a cavity early enough, where does your mind go? I thought I was like, "What?" If
Oh
you
yeah.
can you share?
It's I mean, and I know this aligns with your thought philosophy also. Your bodies are designed to heal. They are designed
Right.
to get better. And so if you catch a cavity early enough, it wants to heal. It starts working immediately to try to send more minerals to support the area. The tooth just has to have what it needs in order to do so. So yeah, if we catch a cavity when it's really early and it's still in the enamel in that outer layer of tooth structure, then a lot of times we can shift what patients are doing at home. We can provide small things that are supportive, like ozone and a strong remineralizing paste, and we can hopefully get that cavity to at least stop in its tracks and hopefully heal and completely go away.
Yeah, that's just like we're not taught that. It's like, no, once you have a cavity, it's done. Like, I mean, and I
Right.
guess, it's kind of like anything with the body. If it's so far progressed, like we may not,
Mhm.
at least in our current knowledge, be able to bring it back. But like even a early on cavity, like that's not in the psychology of most, at least Americans. It's like that there's nothing you can do about that. It's done. It's over. So it's
Yeah.
like, wow, okay, well that makes sense. It's kind of like anything else in the body. It makes me think you talk about stuff you can do at home, and it's like, man, I feel like this is systemic, not just the mouth, but I'm like, man, we're like in such a rough spot as humans because not only do we have all of these like aggressors against, we have like the high fructose corn syrups and the processed everything and the, sugary, starchy, processed white flours and chemicals and all these things our bodies have to deal with. But then on top of it, our food system, which I mean, it's tough. Like I enjoy going to Costco and being able to get like anything I want. That's really cool. But we're paying a price for it because just our mineral and phytonutrient levels in the food, like even if you're eating healthy, are a small fraction of what they used to be. So it's like, oh, it's like it just feels like we're sitting ducks sometimes
Hard.
because we're just
Yeah,
not getting what we need appropriately. And then we have all of these attackers constantly coming at us at the same time.
absolutely. Absolutely. And I don't see that part getting that much better anytime soon.
Yeah. Do you recommend are you I don't know if you do this as part of your practice or if you leave this to like the NDs and the functional medicine docs, but like do you recommend like mineral supplements or, vitamins and those kind of things? Like what kind of things should people be thinking about that
Yeah,
way?
well, we always try to start with food where we can.
Mhm.
So healthy fats, we've got to make sure that everybody, especially our kids, are getting lots of good, healthy sources of protein and healthy sources of fat. My preference is, if we're really trying to fight tooth decay, my preference is more like a paleo-ish type of
Mhm.
diet where we're having animal protein, and
Mhm.
good quality animal proteins and
Mhm.
fats there. It's possible, but it's a lot harder for our
Mhm.
vegans and vegetarians to absorb the nutrients that they need. But then for supplements, yeah, absolutely. We do a lot of cod liver oil for our kiddos. We'll have a lot of people do trace minerals. Um, let's see, try and make sure vitamin D levels are
Mhm.
where they need to be. So a lot of times we'll have people supplement with D3 and K2
Mhm. Why do you bring up fats out of the gate like that? Healthy fats.
because most of the nutrients that our teeth need are fat soluble vitamins. They're not the water soluble ones. So water soluble vitamins like your B complexes, your vitamin C's, those are great for gum tissue, and helping with inflammation. But for teeth, it's your teeth need vitamin A, D, E, and K, and those are all of our fat soluble vitamins. So if we're not getting enough fat, we're even if you're supplementing those vitamins, it's going to be harder to absorb those, and you're not going to get as many naturally either.
Thanks. Um, can you talk about, I heard you talking about, sealants. Can you talk
Mhm.
about sealants?
You sure can. I fell out of love with sealants. So I'm certainly not going to judge anyone who had sealants, places sealants, got sealants for their kiddos' teeth. I used to have sealants on my teeth. But I don't perform them anymore just because for one, I philosophically disagree with placing sealants on our kids' teeth. It's
And
really just a sealant is like this runny resin type of material, similar to our filling material. It's just a little bit more runny so that it can get into those deep grooves on the chewing surface of the teeth to prevent cavities. And when you look at all the research, most of that research is done looking at, sealants for after they've been placed for 4 to 5 years. And the research during that time period is good. Sealants can prevent tooth decay. Over the course of 5 years, people have less decay in those deep grooves of the teeth. But philosophically, I disagree because I don't think that we should be coating our kids' teeth in plastic to prevent cavities. I'd much rather work on their oral microbiome and get things into balance so that their teeth are naturally more resistant to cavities in the first place. Um, but beyond that, because I'm a general dentist, I'm not a pediatric specialist. I get the pleasure and the benefit of seeing patients over their whole entire lifespan. And so, yes, while sealants may statistically do a good job at preventing cavities for those first 5 years, when I see patients in their 20s coming into my office, a lot of times those sealants are chipped in places, they may partially be there. And I kid you not, probably once a week, I will see a cavity that's hiding underneath an old sealant. And the problem is that they can actually get a pretty decent size before we find them because the sealant
Wow.
uh, provided the breeding ground, once it's not perfect, once it's chipped a little bit, it provides the breeding ground for the bacteria, but then it masks it from my view and hides it to where by the time we see
Wow.
it, the cavity's larger than it would have been otherwise.
Wow. So you're
So
seeing those often, once a
I'm
week.
seeing them
Eh,
often. I don't like
Wow.
it. Makes
Wow. Thanks for sharing that.
makes me upset.
Wow. Okay. I'm not sure how much you know about this, but I always get so curious about other populations. Like, even if we're talking possibly genetics, maybe lifestyle, maybe food system, maybe the, types of medicines that are presented there, which, I'm at the more people I interview on this podcast, the more I'm like, okay, so like almost every other country, it feels like blends natural or functional medicine with Western, what we call Western medicine. It's like, it's all the same thing,
Yeah.
So I'm curious, like, are you aware of other populations where they just have like really great oral health, really high statistically?
Yeah, I mean, there are fewer of them now,
Okay.
but they're one of the cornerstone books of biological dentistry was the work of Weston A. Price. It was, early in the 1900s, and he did his work studying. He was a dentist, and he did his work studying the some native communities. He studied Aborigines, studied other, very communities that had not been exposed to a Western diet or Western lifestyles. And they did have just amazingly healthy teeth. And what was shocking was
Wow.
that those same those same people, so they were genetically the same within just a decade of then moving to a more modernized society, they had all of the same dental
Wow.
issues that the people in the modern society had. And we're not just talking about tooth decay, but that is one of the major things. No, the scary thing was how different their face and their jaws are actually shaped. So, these traditional native diets and native lifestyles, they had these beautiful broad jaws, these wide smiles that had plenty of room for all of their teeth. Um, so if the jaw is wide enough, that also means the airway is wide. And
Mhm,
so these people are sleeping better and
mhm.
they're able to breathe better. And what we see now in our society, and I think most modern societies, it's we from birth, from in utero, we have kiddos who didn't breastfeed as much, especially, thankfully, I think that that trend has reversed a good bit, but still, we're not breastfeeding as much, or we're starting our babies on food that's not real food, starting them on cereal and mushy things,
Mhm.
and all of these are not developing the musculature of the jaw and not encouraging this beautiful, wide, open mouth. And so that is how our mouths have literally grown to develop. We've developed these narrow mouths and narrow jaws that don't have enough room for all of our teeth. We're eating, meals and carbohydrates that are much more easily digestible. And so it's making us all much more prone to tooth decay. All the inflammatory issues that come along with that make us more prone to gum disease. And like I said, a smaller jaw means smaller airway, means we've got an epidemic of snoring and sleep apnea, and it's happening younger and younger. So in our kids, it's not snoring and sleep apnea necessarily, but it's ADHD, it's learning disabilities, it's allergies, dark circles under the eyes, the need for more orthodontics, all of these things that are modern creations, not
Wow.
something that our ancestors were. exposed to.
Wow, thanks for sharing that. Yeah, I always think like I've always thought, I'm like, why do we have to get wisdom teeth out? And in James Nestor's book, Breath, he kind of hits on some of this. It's such a great book.
Yes.
But yeah, it's just like I'm like, okay, this doesn't make any sense. As intelligently as everything was designed here, that we should be like losing all our teeth. We don't have room for our wisdom teeth. We have to get them surgically removed. Why would they even be coming in if we weren't supposed to have room for them? And
Right.
and yeah, he hits on a lot of this, and I appreciate you sharing your perspective too. And yeah, I mean, orthodontics, what do most kids have to
Oh,
do?
I've
They
got
got
it
to
right behind me.
you have it right behind you? Oh, the
Yeah.
breath. I see it, the yellow one. Yeah, great book. If you guys haven't read it, that's like a must read.
It is.
Um, but yeah, like, I mean, my kids, they had to have those expanders and all of that. And that's like
Mine too.
probably incredibly common now. So
Absolutely. Absolutely. Yeah,
yeah.
we shouldn't, and yeah, it's not our fault. It's just how our society has,
Uh-huh.
what we've decided was more convenient, turns out had some disadvantages on the back end.
Oh, you're making me think. One other question I had was, like, how some people, it just seems like they never have cavities. They might not even like have that great of oral hygiene. I like never had a cavity in my
Mm.
life. And then some people are like, I brush and floss religiously and I always have cavities. Like what's going on there? Or what are some insights that could possibly be going on there?
It's clearly not just about brushing and flossing, because yeah, that happens all the time, especially in marriages. It seems like the wife will come in and she's religious about everything, and she'll come in with a cavity every visit, and her husband, I don't even know the husband. He's only been in like one time in 10 years, and he's got nothing. And so we just sit around and we cuss out the husband for a little bit on how unfair that is. Uh, No, but seriously, there are many causes. The tooth decay it's a chronic illness. It's a chronic infection. And so it's definitely not just brushing and flossing. It's not just diet, but diet can impact the rest of our health. So we have to look at, how strong are our teeth intrinsically, which is all related to how healthy is our gut. If we don't have great gut health, then we're not going to be absorbing the nutrients that our teeth need. And then is our salivary pH at the right level, or are we too acidic for too much of the time? That can play a huge role. And then is our microbiome out of balance? Do we have too many of those decay causing bacteria? Do we need to rebalance things with more of the beneficial bacteria?
And then, like, I mean, not to overdo genetics, because obviously so much of the power is in our hands, but I mean, genetically, do some people tend to have weaker enamel develop than others?
Very, very small percentage.
Wow.
Very small. So you
Okay.
really do have the ability to change it. It's a tiny percentage of those who truly genetically just have bad teeth.
Nice. Okay, thanks for sharing that. And okay, so you guys are in Richardson, Texas, Flourish Dental Boutique. So if you guys are in the area, obviously you're fortunate here. But in terms of everybody else listening to this, you mentioned there's like they might be called holistic dentists or functional dentistry or whatever, but like, what would you recommend somebody do if they're listening? They're like, okay, maybe I am going to switch. I mean, what should they know? First of all, like our insurances are probably not usually part of it. Do you
Say
know?
fewer of us use insurance than our more traditional colleagues.
HSA, FSA, that kind of stuff. Do you know?
Usually still works a lot better.
Okay.
Like in my office, I accept insurance, I file it. I just file as an out-of-network provider. I just try
Mm.
to I try to not be tied to the insurance, because then
Hmm.
I'm tied to what
Yep.
they prefer, and I would much rather have my relationship with the patient instead of with the insurance company.
Hmm.
So yes, there are fewer biological dentists who
Right.
use a ton of insurance. There are a few though. I would say the best thing to do is look up that organization that I mentioned earlier, the IAOMT. And their website is just now, I did not come up with the acronym. Don't get mad at me. They came up with that in like the 70s. So the IAOMT.org is the group that you can go to, and they've got a really good directory where you can look
Mm,
up biological dentists. You can even see like how many meetings they've been to. Do they have their certifications in biological dentistry? So you know who's just showing up and who's really like been invested in the organization and in the research. So
mm,
that would be where I would recommend going. And I think all of us in biological dentistry, we have patients who travel just because once you decide that that's the direction that you want to go, then you typically don't have to come that often. So we'll have a lot of
mhm.
patients that'll travel if they need something big or want to get some stuff done. And a lot of people will just go back to their normal dentist for the regular checkups and stuff.
Cleanings and stuff. What's
Yeah.
the closest airport to you guys if somebody wanted to fly in?
DFW, we're right outside of Dallas.
Okay, awesome. All right. Well, thank you so much for sharing. That was super informative, straight to
Right.
the point, and probably paradigm shifting for a lot of people. There's a lot of stuff. I mean, I've been vaguely familiar with biological dentistry, and I've talked to many biological dentists, and I still picked up new things I'd never heard before. So, thank you so much for
Good.
sharing.
Oh, you bet. It was fun.
Thank you so much for joining me on this episode of the Inside Out Health Podcast. I hope it's been helpful to you in your journey. If you think that it might be helpful to someone you know, please share it with them. Please share on social media. It really helps me grow the show and reach more people with these amazing messages. And if you could be so kind as to rate the show and possibly even leave me a review, that really helps. So much thanks in advance if you do that. And yeah, please subscribe if you want to hear more of this type of content. I have lots of amazing expert guests on the way. All right. Thank you.